Hello, everyone. Welcome to the webinar. We have several people logged on right now, but we are just waiting for a few more based on the sign-up sheet, so we're going to be starting in about 2 minutes. Thank you. Hello, everyone. How are you today? Welcome to the webinar, Looking Beyond Hospital Walls, How Community Collaboration Brings Value to Community Health Assessments and Implementation Plans. Before we begin, we just want to remind everyone, once you've logged in, please remember to enter your PIN into the phone. That way you'll be hooked into the audio of the webinar. And we also ask that if you have any questions or are having any technical difficulties, to please put a question in the question box, which you will see on your panel as well. With that said, I'm very happy to begin today's webinar. First, I'd like to thank everyone for participating today. I am Lisa Wolff, Director of Research and Evaluation at Health Resources in Action. And for those who are not familiar with our organization, we are a nonprofit public health consultancy organization who's been working with hospitals, health departments, foundations, and community organizations for over 50 years to improve population health. And so this afternoon is part of HRIA's continuing webinar series on critical issues and approaches in public health. And as you know, today's talk focuses on looking beyond the hospital walls, and we're going to be talking about community collaboration and the assessment and implementation planning process. So moving on to the next slide is the agenda. So today we're going to be talking about the benefits of collaboration from assessment through planning and implementation. But today's discussion is not just about the specific tasks discussed in the IRS guidelines for hospitals, but it's an exploration of the strategies for making collaboration and partnership work and the steps for getting them off the ground to benefit a multitude of organizations, and most importantly, to benefit the community's health in a coordinated and sustainable approach. So in the first few minutes of this webinar, I'll be talking with my colleague Rose Swensen, who is HRIA's Director of Strategic Planning and Organizational Effectiveness, to talk about the importance of collaboration between hospitals, health departments, and community organizations, and also an overarching framework in which to consider the continuum of collaboration with the community partners you have or are hoping to engage. Then we will be hearing from two illustrious speakers from the field who will be talking about their specific examples. First, we'll be hearing from Monica Lowell, who is the Vice President of Community Relations at UMass Memorial Healthcare in Worcester, Massachusetts. And that is an example of a long-standing relationship between an academic medical center and the local health department, and how the hospital used the collaborative assessment and community health improvement planning process as a springboard and foundation for the hospital's community benefits plan. Then we will hear from Pilar Oates, who is former Executive Director of Methodist Healthcare Ministries in San Antonio, Texas, and a board member of the Health Collaborative, which is a long-standing formal collaboration between multiple hospitals, the local health department, and community organizations. Lastly, Rose will then discuss specific strategies and action steps, as well as lessons learned related to the collaborative process. And so I want to just note one piece of housekeeping. In between each of our speakers, after Monica, after Pilar, and then at the end, we've set aside some time for Q&A. So we ask that participants type in their questions in the question box that you see on your panel, and then we'll address them during those designated times. And as I mentioned before, if you have any technical difficulties with the webinar, please also type your questions in that box, and we'll try to address them during the webinar. So this slide outlines the objectives for today's webinar. We want to recognize that collaboration is happening in most hospitals and that there are numerous challenges in strengthening, scaling up, or expanding the collaborative process. And we hope we can give examples here of people who've done it and the next steps that you can take to move your collaborative relationships to the next level. So before we begin, we'd like to get a sense of the group. We're going to do a poll, and so if everyone will just stand by for a moment. The poll is, I'll just read the question first as it comes up on your screen. In your current or most recent assessment and planning process, are you leading the process alone, or are you collaborating with other organizations and agencies? And so you should have a poll open. And so it looks like, I'll wait, I'll give folks a moment to answer. Yeah, I think some people are still filling it out. And so it looks like at this point, about 94% of participants, 95% I should say, are collaborating with other organizations or agencies. So as we suspected, a lot of people are already collaborating with other organizations, and so a lot of the conversation is really how to expand that process, improve that process. And so our next question is really, for those who are collaborating, which is most of you, with whom are you collaborating? And we just ask that you check all that apply. If this is other hospitals, FQHCs, the health department or departments, community-based organizations, or others. We'll just wait a moment as folks are filling this out. So with most people responding, we have about 83% who are collaborating with other hospitals, 44% with FQHCs, another 83% who are collaborating with the health department, everyone who is collaborating with a community-based organization or coalition, about 20% with others, not listed from our list. So that's very exciting to hear. So I'm going to talk just very briefly why consider partner collaboration, although this is quite sort of the notion of the participants here who are already doing it probably support these points as well. So as reiterated in the sessions at the ACHI conference last week for those who attended, the field is moving in a collaborative direction. For hospitals, this can be seen in the exciting opportunity in the Affordable Care Act, which has emphasized the intersection between public health and health care. On the public health side, we see the health department accreditation process encouraging collaboration as an important part of providing essential public health services. But beyond requirements, collaboration has really become a necessity to leverage and stretch resources, especially in these challenging economic times. Additionally, it's an approach for thinking about alignment and sustainability of efforts. If multiple institutions and agencies are focusing on a similar goal, but they're coordinating their efforts to improve community health. And on the practical side, in thinking about this alignment and coordination, when communities undergo a larger community health improvement planning process, or CHIP, it's really an ideal opportunity for hospitals to use that larger CHIP as a foundation for nesting their strategic implementation plan. They can discuss what parts of that larger plan the hospital itself can reasonably take on versus where it makes sense for other organizations and agencies to take the lead. So as I just want to talk a little bit about outlining the steps towards a larger community change process. This diagram here highlights just a few key areas of how a collaborative approach is beneficial. So first, when considering the assessment, we know that health departments considering accreditation need to conduct an assessment. FQHCs need to conduct one. United Way's conduct one. Other organizations as well may be taking on similar efforts. So conducting a collaborative community health needs assessment helps not only use resources efficiently, but it also gives everyone a standard set of data and measures on which to use as a basis for planning. Also importantly, starting the collaborative process early helps build buy-in and a knowledge base for implementation. And it could also help foster those champions who will help the process later on. On many communities, as we move sort of around the circle, a CHIP is being undertaken at the community level. And as I mentioned in the previous slide, hospitals can use the larger community plan to map out how a hospital's efforts could align with what is laid out in the CHIP. This can reduce duplication as well as coordinate community engagement activities in order to minimize stakeholder burden. Obviously, there's an array of activities that can be coordinated with the implementation of initiatives, and then in evaluation, collaborative relationships can then help for the evaluation to be collaborative. Partners can help in data collection, analysis, and dissemination. And evaluation results should be tied back to both the strategic implementation plan and the CHIP. And the evaluation results can also be used to inform the next community health assessment, as we can see progress on reaching benchmarks and milestones. And since the next assessment process needs to be conducted in 3 years, this is probably about the time when the first wave of evaluation is being completed from the previous process. So we can see how one process sort of leads in and lays the foundation for the next. So now I'd like to turn this over to my colleague, Rose Swensen, to discuss some of the specifics of collaboration within this process.
Good afternoon, everyone. This is Rose Swensen from HRIA, and I am delighted to be joining you all on this webinar this afternoon. And I'm going to speak very briefly about sort of a context for thinking about assessment and planning, and maybe a different lens from which to view these activities, and then share with you a model for how you might consider approaching your partnerships and your stakeholder engagement to really start to move towards this whole notion of sustainability. So, you know, as Lisa has shared, and what we have learned working with community groups and health departments and hospitals nationally on their assessment and planning processes, we've learned that there's a lot of time and a lot of effort spent collecting and analyzing data, getting the right data, a lot of time put into developing the components of the plan. But then once that document is produced, or those documents are produced, the question of implementation looms really, really large. And we know that complex problems require kind of sustained and collective approaches to move the needle. So the question comes up, how do we really engage key constituencies effectively? How do we motivate them? How do we make that engagement meaningful beyond the tasks, which are significant, of completing an assessment and completing a plan? Because this is really about driving action and demonstrating results. So when we think about implementation and we think about sustainability, what if we were to consider this from the perspective of a change process? And when we think about change, there are changes happening on multiple levels and interrelated levels to really implement any of these plans effectively. There are organizational changes that need to take place, both internal to organizations, but also around new coalitions and new collaboratives that might be forming. There are systems and policy changes taking place in the environment. There are population health changes that we hope to measure along key indicators, and several other types of changes. So if we were to consider this rather than a set of tasks or activities moving from assessment to planning, or as a change process, what might we do differently? Next slide, please. Next slide, please. So here's a model that we'd like to share with you as a point for consideration, and you'll hear some examples from our speakers and panelists about how they have worked their collaboration, but really it's looking at stakeholder groups and constituencies at multiple levels, from cooperation to collaboration to partnership, and really looking at how you move your constituencies and stakeholders from that base of cooperation where you could have a lot of support and a lot of players, but a less intensive engagement, up that pipeline to a more selective kind of strategic partnership. So as you go up that y-axis, you see, fewer players, but deeper relationships and deeper levels of connection. Next slide, please. When we're talking about that first level around cooperation, this is a state that exists for most assessment and planning efforts. And the idea here is to build or create a trusting and open space where various players can learn about each other and each other's work as they begin to move towards creating a collective vision and some momentum for change. And this is a whole level of possibility. There's a possibility of select members at this level to start to move up the pipeline. And what is really needed at this level is regular information sharing and opportunities for networking and relationship building to really build that sense of shared knowledge and that trusting space. Next slide, please. As you move up the pipeline to collaboration, and we use this term a lot, this is a deeper level of engagement where agencies and groups are beginning to align their efforts, are beginning to focus on shared objectives and strategies to achieve common goals. And this middle tier is really the basis of effective planning. So when we talk about, yes, we're engaged in collaboration, a lot of collaboration occurs at the assessment and planning level. And this level is really about true and meaningful engagement, but also champion building, because members at this level will become the advocates and the spokespeople and the representatives of this vision for change. And what is really needed here is the focus and a plan, some data sharing, and then, of course, the convening and connecting of these various entities around collaboration. Next slide, please. And lastly, when we're talking about the level of strategic partnership, this is the highest level engagement where organizations are so deeply connected to each other's missions and work that they simply cannot be successful in their shared goals without integrating their efforts. And this top of the pyramid is really the basis for sustainable kind of systems change. These are the change leaders of any collaborative effort and represent the core circle of committed entities who will lead and convene and drive for results. And what is needed to make this work at this level is some sharing of resources, whether that's people or finances or infrastructure, and the ongoing monitoring and evaluation that tells that you're making a difference. Next slide, please. So as a case in point, it's my pleasure to introduce our first speaker, Monica Lowell. She is the Vice President of Community Relations of UMass Memorial Healthcare in Worcester, Massachusetts. And she'll be talking about UMass's unique partnership with the Worcester Health Department and how it has been instrumental in both the assessment and planning processes for the community of Worcester, but also for the community benefits process for the hospital. Thanks, Monica.
Okay, good afternoon. Hope everybody's doing well. This is Monica Lowell from UMass Memorial. And what I have the next slide, please. These are just pictures of all of our community work. Go to the next slide. So as Rose indicated, I am going to just give you a little bit of background on our relationship with the Worcester Health Department and how we looked at our indicators, develop a process for conducting our community health needs assessment, went on to develop a community health improvement plan, and talk a little bit about how we brought that into our community benefits plan and strategies, and then what are we doing after all of this, because that's where really the whole work begins. Next slide, please. So about Worcester, Massachusetts, we're the second largest city in New England, an hour west of Boston. And in 2009, when the market went crashing, our health department was faced with drastic budget cuts. Around that time, if you also remember, was when H1N1 was surfacing, and there was a lot of turmoil. So our city manager reached out to our hospital CEO, John O'Brien, and asked that he help him in pulling together a public health task force that would develop sort of a map strategies for preparing our department to work in a better way, because funding was just not going to be there. And so this required pulling together many different stakeholders, the community health centers, the medical school, residents, community-based organizations, you name it. And also what was important was bringing the other big major healthcare provider, Vanguard Health Systems, which is for-profit, to also co-lead the public health task force. The task force got together, organized different groups, and then also looked at how the public health department might function better. So as a result of that, there was a report that was pulled together with recommendations that was also looking at ensuring that we had some best practices incorporated as the health department moved along. That report was developed. The recommendations were presented to the city manager, and he carried them on to the Worcester City Council for approval. Part of also what we have done is, through our community benefits, is fund the Commissioner of Public Health. But really, this is not just about funding. It was also about seeing how we can work together, engage that Commissioner of Public Health. So we found it was pretty great opportunity to start working on the community health needs assessment. There are a lot of players in the community that needed to do assessments, and having the commissioner was important in this effort. But what was also very important was that we decided that the whole process needed to be led by the health department and by the hospital. So the whole needs assessment was co-chaired and guided by the Director of Public Health and by me. And so we went through developing the assessment, and then we went on further and developed the Community Health Improvement Plan. Next slide, please. Thank you. We developed the Community Health Improvement Plan, and part of what we did with that, too, is that we said if we're going to do this Health Improvement Plan, we need to also bring it into our Community Benefits Plan. So part of the process was to bring the senior leadership, meaning our CEO, the Senior Vice President, bring the Health Department and community representation to look at what we have been doing in terms of community benefit and investments, and also how it aligns with the CHIP. So we did that work, and we developed a 3-year plan for that. We also had the opportunity to meet with the health department and say, out of these different priorities, and we have 5 of them, what things do you think you might be able to fund? What things we might be able to leverage funding, so that we're all working on the goals together. And that way I found that very productive. The health department was delighted to be part of the group. It was a lot of work, but it then was wonderful because we were able then to take our community benefit plan and present it to our Board of Trustees Community Benefit Committee, and then be presented to the Board of Trustees for approval. So that's how we incorporated our community benefit plan with alignment with a CHIP. The other piece that we're doing now is working with a community and seeing how does a CHIP get incorporated and who can help move it forward. And so for each of those 5 priorities, we identified key, what we call conveners, that we're going to meet with different stakeholders in each of those priority areas and see what pieces they could own and they could align with some of the goals and objectives of the CHIP. So we've been doing that, and we also have been asking and seeing where we might need funding for that. In some places, we have been able to secure some funding. In other situations, we have been going to different funders, private foundations, presented our community health improvement plan to let them know that as they're looking into giving money out, that we would like them to look and consider our community health improvement priorities. And that has been working very well. We haven't completed all of it, but that's an ongoing process right now. I think the education to the funders of how they can contribute in this collective impact approach is very important. And part of what we are also developing is a way of making sure that we're monitoring and developing a communication plan so that the community knows what's going on. As you know, a plan can be flexible. Some things work, not work. There may be adjustments, but the important thing is that we develop that communication and report back to the community. So that is what I have to say for now.
Thank you, Monica. Greatly appreciate hearing about the specific example of what's happening in Worcester. I'd like to open up, this is Lisa, questions to the floor, to the participants. See if there are any specific questions for Monica regarding what's happening in Worcester with the hospital and health departments and all of their community partners, or related to any of the conversation that Rose and I gave before Monica spoke. We'll also have other opportunities for Q&A, but if there are any questions right now, if you want to enter them in the question box, and we'll stop here for a few minutes to answer some of those questions before we move on to our next case study. So it doesn't seem that we have any questions at the moment. I'm just going to, okay, we do have one now, and that question was, how did you prioritize the specific health issues in your community?
Okay, that's a great question. So that was the whole process that we did, is we invited people to come to a couple of sessions where we gave information on what we have found that were issues identified in the community, and then people, there were close to 100 people that showed up, and we facilitated, it was facilitated session. Actually, HRIA was in that session, and the community worked in identifying what was important, and then people were separated into groups, and it was all through a couple of facilitated sessions. So we provided the information that was collected through the needs assessment, and then we invited the community to come in and help us in identifying what was important.
And I think
Rose might be also, Rose, are you there?
Yes.
Yeah, and Rose was actually in that meeting too. So do you have anything to add?
Yes, I would love to. Thanks, Monica. The prioritization process we used with, as Monica mentioned, a group of about 100 community members and leaders was to present a summary of key themes and findings that came out of the community health assessment, to have an open dialogue about any items that needed to be added to that thematic list, or any items that needed to be rearranged. And we spent quite a bit of time talking about, what issues or themes could be clustered, and what needed to be added, and what was more of a kind of cross-cutting strategy as opposed to an issue. And in the end, we developed a list of common criteria, and we used a dot voting exercise with all the participants in the room to come up with a final list of priorities. And from a beginning list that started around 15 to an expanded list that went to about 45, I think, Monica, we arrived at the 5 core priorities that wound up in the chip.
Great, thank you, Rose. I'm going to just open it up for another minute or so to see if anyone else has any other questions specific to the Worcester example. So we are going to have other opportunities for Q&A as we go through the webinar, but at this point, I'd like to turn the conversation over to Pilar Oates, who is the former Executive Director of Methodist Healthcare Ministries, and she is also a board member of the Health Collaborative, which she'll be speaking about, which is a formal collaborative, a 501c3 organization that is comprised of multiple hospitals, the health department, and other members that has been around for many years and has quite a long history of working together on the assessment and planning processes through multiple iterations of this. And so we're very excited to hear about her experiences regarding this collaborative group.
Well, thank you, Lisa. I'm delighted to be with you today. And I really would like to begin by saying that our experience was very similar to your pyramid process. And clearly in 1997, as we started to have this conversation, we were very much in that cooperative mood and beginning to talk about how can we do something better and how can we create an opportunity for the hospitals to have a joint assessment that would really bring a different meaning to just complying with a community benefit requirement. I have to say that the most important thing that I could guide anyone to do in any collaboration is to ensure that you have a common mission. And to improve community health through collaborative means became a guiding light for us. And I think through the years it has continued to be the way in which we stay aligned with our mission. We continue to focus on improving health through collaborative means. Next slide, please. Next slide, please. The purpose is clear. It was a regulatory one, but we wanted to do more, as I said. And so what I want to focus on here is that not only do we empower the community to take responsibility for their own health and build collaboration, et cetera, but guiding local policy and programming in public health areas is a critical way in which we can really improve community health. I want to give an example recent here in Texas, in San Antonio. Recently, the state of Texas has been involved in an 1115 waiver process, and that's how we look at reimbursement from CMS. And clearly, that requires a lot of understanding of community health because the 1115 waiver process now dictates, instead of reimbursement for service, it's going to the way that all other health care is going, and that is fee for performance. It's heavily based on health outcomes. So you have to begin with a good health assessment. And we were very delighted that one of our partners at the table, University Hospital System, who is now the anchor for the 1115 waiver for this region, relied heavily on the assessments that we have done recently and historically to develop the plan, to develop the 1115 waiver plan for this region. So that's an example of how we have evolved, how the players at the table have found meaningful ways in which to rely on the collaborative assessment and to improve community health. Next slide, please. I want to say that the greatest community benefit is understanding the health status of that community. And so this requires having a health assessment that does and goes beyond far more, that is far more reaching than just giving here are the health disparities. You need to understand why they occur and in what context they occur so that we can find a good place to intervene. And that's how you improve health status, by active participation, by ownership of your health, of the community health. So we were one of the first cities in our 2010 assessment as we evolve and continue to evolve into a greater collaborative organization. We were one of the first cities in the country to use the social determinant model to describe community health. And that is clearly understanding the why of something. What is the social contextual environment that exists such that this health disparity, this health outcome is occurring? And when that happens and when the community gets a clear picture of why this might be happening, then you begin to look at comprehensive ways and real serious ways in which you might intervene to change that outcome. Another way in which we have done a much better job is the incorporation of the CHIP. We have always had Metro Health at the table, and we have availed ourselves of the data that Metro Health certainly collects and distributes throughout the county and the community. But for the first time in 2010, and this is thanks to HRIA because they helped us to make this a more seamless process, we were able to really develop and to bring to community the sense that the community health assessment really needed a response, and that the CHIP was that response. The community health improvement plan was the natural response, the so what of it. So what if you have an assessment, and this is what we talked about earlier, that says these health disparities occur in different sectors of our community? Well, then the so what of it is let's make a plan. So the plan naturally that existed before, somewhat independently of the health assessment, was now connected deeply. And the community became aware of this connection. And so when we convened the key stakeholders and the community to let them know the results of the health assessment, we immediately talked about the community health improvement plan. And so here was the expectation of next steps, and also an opportunity to involve the community. So where do you fit, and what can you do, and what is your role in the community health improvement plan? And so what we did at that time is to begin to educate the community about the marriage, which we all said was a good chip and chaw dance, the chaw and the chip and the chip and the chaw. And what we really were able to do successfully with the background of HRIA helping us to do this more seamlessly, we were able to help the community understand that this is an ongoing process, that we need to continue to look at this process, and one informs the other. So that is how I think we have continued to come up that pyramid that we talked about. The next slide, please. This next slide shows the current members of the Health Collaborative. And I think you can see by looking at the list that it has gone beyond the hospital membership. And this is very important, and I would urge anyone who's listening to the webinar to consider this very important piece, because I think next we're going to talk a little bit about sustainability. And you cannot have sustainability unless you have community ownership of its health. And clearly, the hospitals are not the only stakeholders in the game. You have to involve the community, and their voice has to be represented. And you can see that we now have the YMCA of Greater San Antonio in our group. We have a university, Our Lady of the Lake University, represented. We have community members. We have still our hospitals that are very important to our group. And we have some business in App Diction Studios, a wonderful group that creates apps for the iPhone or the iPad for health purposes. In this case, they are currently doing something in the community around bullying, and it's a very, very important and significant, on-target intervention to so many of the things that we see in our community. So at this time, if you have any questions, we can open it up for that.
So please, if anyone, thank you, Pilar, for the explanation of all of the incredible work that's happening in Bexar County and in San Antonio. We ask if anyone has any specific questions for Pilar, if you could type them in the question box. And then we will have Pilar or any of our other speakers, if it's appropriate, speak to them. We'll also have another Q&A session at the end. Wait to see if anyone's finishing typing. It doesn't look like anyone has any specific questions at this time. So thank you, Pilar. If you do have a question for Pilar that comes up later, as I said, we are going to have a Q&A session at the end. But at this point, I would like to turn the conversation over to Rose Swensen, HRIA's Director of Strategic Planning and Organizational Effectiveness, who is going to talk specifically around key strategies and lessons learned and sustainability in this approach.
Thank you, Lisa. This is Rose again, and hi again, everyone. And thank you so much to Monica and Pilar for sharing your stories. And there's some kind of clear lessons learned, I think, from both of your examples. One is that economic hardship can present challenges and difficulties, but it can be a very powerful motivator for creative partnership, as was the case with UMass Memorial and the Worcester Health Department. And the importance of having shared resources, in this case, having the hospital support the position of the Commissioner of Public Health really helps to substantiate and solidify that partnership and to provide a basis for very meaningful work together. So the other piece that Monica mentioned is really that from the basis of that partnership came this co-facilitated model, co-led model for CHIP development and CHIP implementation and leadership, and the opportunity to leverage funding and share responsibility across the CHIP, because that model of strategic partnership had already been well cultivated from the basis of several shared needs. So shared needs kind of created opportunity for that creative partnership. Early on, and Pilar, I appreciate your kind of recognizing that you had been in a cooperative mode, and you recognized, I think, or came to the conclusion that you could do better. And that became sort of the basis for a new vision that went beyond simply kind of checking boxes and ensuring compliance, but to really initiating change in the community and empowering the community to be deeply and meaningfully engaged in that process. One of the things that you said, Pilar, is that for sustainable partnership, the key is to have a common mission. And I would add to that from two perspectives. Coalitions and collaborations succeed or fail largely on the basis of a common mission, but also a common vision for the future, and that piece that you are building together, and shared values for engagement. And if the partners or the collaborators around that common table do not share that sense of vision and mission and values, it's problematic from the start to have a collaboration and a partnership that continues and is sustainable. Next slide, please. And one of the last pieces that I did want to mention that we took from both Monica Pilar and Pilar is that as we're looking to have agencies and groups and community members and community leaders take ownership and invest in what we're calling a change process, this health improvement process, they need to do so from the basis of shared common knowledge. You can't ask people to come to the table as equal leaders and equal participants and equal champions if their understanding of the data and the conditions and the vision is different. So building that common knowledge base is very critical in the early stages so that you have that buy-in very early on in the process. And so what I wanted to share some thoughts with you about sustainability, because we are talking about taking a plan, implementing a plan, and making sure that there is energy and momentum to continue this important work. And sustainability is really about embedding this way of thinking and this approach or this practice into everything you do and into everything that your partners and collaborators do. So it really stems from that basis of a shared vision and mission and values. So that no matter what happens, if the economy goes up or the economy goes down, if people leave, if new people come on, you have something that glues you together because you have nested this way of thinking and this practice deeply, deeply into the partner organizations and into the community itself. Next slide, please. So some of the action steps for sustainability that we want to share with you is, potential strategies to think about, and Pilar mentioned this and Monica mentioned this, is to really begin with the end in mind and to look at a planning cycle or a funding cycle or an implementation cycle as not something that has, a defined beginning and a defined end, but something that is iterative and cyclical. So that, as Pilar said, the cha is the chip is the cha. So right when you are beginning to initiate those conversations, you're talking about the next step, you're talking about the future, and you're talking about the next phase of that cycle. We've heard a lot about the need for engaging community members and partners early and often in the process, and that begins at that cooperative level where you're sharing information and building that basis for shared leadership through common understanding and common knowledge. As you're moving from cooperation into collaboration, looking for individuals and groups who can really be champions either as strong and vocal advocates or as leaders of potential initiatives, as Monica was laying out around the CHIP implementation, looking for a defined lead or group of leaders for each of the priorities of the CHIP to really act as drivers and conveners for those who would be interested in moving that particular priority forward. Next slide, please. So also looking at resources very broadly. We've talked a lot about financial resources, but there are all sorts of in-kind resources that are helpful and necessary for sustainable partnerships. All of those infrastructure resources. So having a place to collect and disseminate data, having a mechanism for ongoing communications, having meeting space be available, having staff who are available and can have a part of their time assigned to particular initiatives. So if every member of a particular collaboration has a stake in the process and is contributing something to the process, it's more likely that you will have that process continue. monitoring, evaluating, and enforcing policies, programs, activities is really important because it is the feeder to continuous improvement, and it is one of the mechanisms for ensuring momentum. And lastly, we can't stress the communication strategy enough, that you have a mechanism or series of mechanisms that you use regularly to keep your community and your partners updated on the progress you're making and the steps that you're taking. Next slide, please. So again, we're looking at integrating efforts, as Pilar and Monica kind of described in their two examples, and we're looking for ways to move people and individuals from that cooperative stance where it's really important to have a number of stakeholders at that level, but are there key stakeholders that we can begin to move up that pyramid to really be true champions and partners for our effort. Next slide. At this time, I'd like to open it up again for any final questions you might have of any of the presenters. That would be Lisa and my opening piece, any questions around the sustainability piece, or any specific questions you'd like to ask of Monica and Pilar, either around strategies they used or how they overcame particular challenges, or anything else you'd be interested in asking the presenters. Please go ahead and submit your question in the question box.
So I will say, thank you, Rose, for the great steps around sustainability and thinking about how to ensure that these partnerships keep their momentum and continue on. During that time, we received several questions actually around evaluation of partnerships, particularly around evaluation tools or evaluating movement from cooperation to collaboration to partnership. I can open this up for others. I'll also answer to let people know we've been involved here at HRIA in several evaluation, assessment and evaluation studies at collaborations and coalitions with multiple partners. And there's a large literature out there on this, looking at the different domains of partnership, looking at structure, communication, coordination, trust, engagement, all of those different kinds of domains to consider of what makes a partnership or a collaboration a success. And there are many existing instruments. One I do want to let people know about is that there is a partner tool out there that was funded by the Robert Wood Johnson Foundation, and it can be accessed at partnertool.net, which is an existing instrument that people can register and use for free, which looks at the different domains of partnership. And if you send it out to your members, and it will map out sort of a network analysis of the ties across partners, and then you can look at that longitudinally to see how have there been improvements in these different domains of what's considered a successful partnership. So that's just one example. And we're happy to talk sort of offline about other specific examples. I don't know if Rose, Monica, or Pilar would like to add anything related to any evaluation of partnership that they may have done in their work.
This is Monica. We are actually looking at the medical school to help us conduct that kind of evaluation, how well we're working. I think it's critical in that we report that back too.
Terrific. Yes. In this case, it's not just looking, when you're looking at the planning process, not just around population health outcomes, but the process itself. And that is, in a sense, also an outcome as far as did we move the community forward in their coordination of efforts, their collaboration and communication with each other. Great.
I think one of the things, this is Pilar, that we have done is to continue to align ourselves with bigger and bigger pictures. In this case, the mayor of San Antonio developed a plan called San Antonio 2020, and that was his visioning process for the year 2020. And we have done a very effective job now of taking our health assessment and health improvement plan and aligning it with his vision such that the greater community understands the achievement and the progress that has been made. And I think this part of evaluation is critical. The community needs to go to a place where they see movement, where they see themselves improving, where they see that it is because of their participation that we are, in fact, improving our health outcomes. One of the biggest things the mayor has done is a fitness council that really looked at transforming San Antonio from a fat city to a fit city. And again, we visited with the mayor during our health assessment throughout CHIP processes, and certainly connecting with all of these processes, aligning to that vision as well. So I think alignment is the word that I want to use here, and I think evaluation becomes more significant and more productive when you align it with as many players as possible, and certainly with this city as a greater whole.
I'd like to echo that, Pilar. I think if you can connect your vision to a larger change process and to certain political initiatives, it gives you a lot of momentum for your work. And the idea of connecting to larger and larger circles, I think, is just a great way of thinking about expanding your reach and your visibility as a collaboration. And in terms of evaluating the partnership, I just want to call out some of what I've heard from Lisa and Pilar and Monica, is that you're really evaluating the partnership from the perspective of three different levels. One is sort of the processes and systems that support the partnership to be effective and efficient. The other is largely, the outcome that the partnership helps to facilitate, which is a kind of a larger benefit for the community. But internally, I think we need to look at how the partnership benefits each of the partners, and that's the sense of that return on investment, whether it's time or thinking or financial resources or what have you. Each of the partners has to feel that the stake they have put in the game returns back to them manyfold, and it's one of the core elements of sustainability.
Thank you, Rose. We have another minute or two left for questions as folks are maybe writing their questions in the question box. I do want to reiterate, because we received a number of questions about the availability of the slides, and I just want to let everyone know that not only is the webinar being recorded and will be posted on our website, but the slides will be made available as well. Participants will be receiving an email in a little bit with a survey link that is a brief sort of feedback form about sort of the usefulness of this webinar, but also in that email we will include a copy of the slides, and they will also be posted on our website as well. So I would like to take sort of the last bit of time and see if anyone has any additional questions for any of our panelists today to post in the question box. It doesn't seem so, and then if we receive some questions after the fact, we'll get in touch with you personally if we weren't able to answer them here. So at this time, I just want to thank our speakers today for their time and sharing their experience. With everyone, I'd like to thank our participants for being engaged and listening, and also for all of the work that you're doing. And so clearly we can see from the participants that a lot of collaboration is happening in the field, and that's very exciting to see as we all aim to move the needle in improving public health outcomes. So thank you, everyone. We greatly appreciate it, and we look forward to talking with you on HRIA's next webinar. Thank you.